Welcome to Inside Winnipeg Politics. I'm Kevin Klein, along with two Winnipeg Sun columnists, Geoff Currier and Royce Koop. Royce is also a professor of political science at the University of Manitoba. Big news in Winnipeg over the last few days, and sad news, was a younger gentleman dying in the emergency room of the Health Sciences Center. Now, I understand that the NDP government came out and they're going to launch another inquest. We've had inquiries and such happen. And this isn't the first time that we have seen a death in an emergency room or other situations. Winnipeg Sun covered recently the lady who lied in an emergency room bed for days and days with an open wound and ended up having to have her leg amputated. Here we are with another death and another inquiry. Geoff, what's the solution? And again, I want to be very clear, as a former Conservative Party member for a very short time, I'll add. And I'd like to add that, yeah, I don't think the Conservatives did a good job at it, at healthcare. I don't think the NDP before them did a good job. And I think that the NDP now, under Wab Kinew, who promised for months and months and months he was going to fix the problem, have done nothing. So where do we go from here, Geoff?
I don't know what the answer to this is, gentlemen, to these kinds of tragedies. And I don't know if we can ever get to a point where we will never see something like this. Many Winnipeggers and Manitobans will remember Brian Sinclair's story back in 2008, where he passed away in the waiting room. And the inquest into that situation declared that it was a problem of racism. Take that for whatever it is. But at the time, then Premier Gary Dewar, when he was getting elected, said, "We're going to fix hallway medicine." Well, everybody remember, Royce, you'll remember the old hallway medicine cry, which is what essentially got the Dewar government elected in the first place, was hallway medicine. So we're going to fix hallway medicine in 6 months for $10 million. That was the pledge at the time. And a couple of years later, Brian Sinclair never even made it to the hallway. And here we are in 2024.
25.
And 2025, I beg your pardon, 2025. And here's somebody else who doesn't even make it to the hallway. So successive governments have to wear this. Again, anybody who has worked at HSC or spent any time there knows that this is among the most difficult, challenging, grueling, stressful jobs you could possibly ever find. And so mistakes are going to happen. Medical mistakes happen. And they happen all over Canada, and they're made by competent people who may be stretched too thin or what have you. But nobody should die in a waiting room. Nobody should die in a waiting room. Mistakes are going to happen, but nobody should expire waiting to be treated in any of our hospitals.
Yeah, it's also, these sorts of things are a reminder that, problems with our healthcare system, they have real costs. And these are huge, stark reminders that they shouldn't obscure the reality that there's lots of hundreds, thousands of people in Canada and Manitoba that are waiting for procedures, that are living in pain, whose needs aren't being met. And it really, in this province in particular, like you'll read stories, focus on little details of the healthcare system. All the waiting time went down by 0.2% in the last 6 months. All they say, it's easy to get wrapped up in the details and forget that the people's lives are terribly impacted by problems with the healthcare system. And when are we going to start talking about actual transformational change of the healthcare system in this country, rather than arguing about little bureaucratic details or increasing the transfer by 2% from the federal government? Let's get on with actually like addressing this from a big transformational perspective. People dying in waiting rooms.
Yeah, and I agree with you 100%. I got to tell you, when the story first came out, I know Hal Anderson wrote a piece in the Winnipeg Sun on Saturday where he talked to Gary Dewar, and Gary Dewar said the only way you're going to fix this is by hiring more doctors and more nurses. Well, all governments, all parties have been saying that for decades now, and they're not able to do that here in Canada, especially not able to do that here in Manitoba. I also hear our government's always going, well, it's just as bad everywhere across Canada. Well, I did a check. So I looked at wait room times in the emergency rooms in the largest hospital in Saskatchewan and in Alberta. Both of them are shorter than Manitoba. Both of them. You can, in fact, drive from Winnipeg to Regina to their largest hospital and probably get seen in their emergency room faster than if
Yeah.
you would sit in the emergency room here at HSC. And I've had to sit there,
Yeah.
and I agree with Geoff. The staff are incredible, and they have a big job to do, and mistakes do happen. And they are flooded with all kinds of problems in these emergency rooms, not just medical. Let's
Yeah.
be
And
honest.
let's remember that HSC turns close to 20,000 people a day through those doors. I mean,
Wow.
it is extraordinary, the
Mhm.
work that goes on there. And I just, as a word of support for the system and the people who are in it, particularly the people who are in it, it's extraordinary the work that they do, given how stressful, how busy they are. Like I say, you're talking about tens of thousands of people every single day. And that's at HSC. And I know that's our largest facility, but all of our medical facilities are extremely busy. I mean, you don't walk into an empty waiting room anywhere, right? We know that.
Yeah.
It's like there are no empty waiting rooms. So, however, having said all that, we keep circling back to this, that there has to be a way to prevent tragedies like this one, or like Brian Sinclair, or any of the other serious incidents, serious medical incidents that happen. There have to be ways to at least reduce or minimize those, and we don't seem to be making much progress there.
Yeah, this is what I say. I wrote an article that's going to be in the Winnipeg Sun about this situation, and talked about the wait times in Alberta and Saskatchewan. But I also talked about the fact that, somebody who's sat in government, I think it's important that politicians start to check their ego at the door. I don't want to hear a politician come out and say that they're going to fix healthcare in 6 months, or they're going to hire 1,000 staff, because you know what? You're not going to. You're not.
Well, Kevin, who believes that?
I know,
Yeah.
but they got elected.
Nobody. You don't fix healthcare. You can
No.
maybe make it a little better, but nobody's going to fix healthcare, because fixing healthcare in some people's minds means all things to all people today.
Hmm.
It's not going to happen.
Hmm.
So let's not be naive about this. I mean, but Royce made a good point earlier, I think, Kevin, where he said we're kind of nibbling around the edges of fixing healthcare, or making it better. We're not really jumping all in. And it's not just about more money. It's not always about more money, because we spend, as Canadians, we spend a very significant amount of money, and we spend more than some other developed nations on our healthcare and get lesser outcomes.
Well, and Royce, maybe you can talk to this. I looked, and there's other countries around the globe that have universal health care that are doing it 10 times better than we are. Why aren't politicians checking their egos at the door, admitting that they're not experts in this field, and reaching out to the people that are successful and making the wholesale changes that you were talking about?
Yeah, well, they should be. I mean, one of the problems is that healthcare eats up a massive proportion of the provincial money, and it grows every single year. If you're in a hospital, just look around you, look at the people, look at the equipment, and that's all super expensive. Like, healthcare is expensive. And so one of the problems we have in Canada is that the federal government has so much money, but it doesn't have the responsibilities that are really expensive these days. Healthcare is a provincial jurisdiction. So the federal government transfers some money to the provinces to help pay for healthcare, but it also spends money on lots of things it shouldn't be spending money on. And healthcare should be a priority. And we should be finding ways to transfer even more money, more tax points to the provinces, so they can actually put the money that's actually going to make a big difference, rather than these kind of small investments that fix some small problems but don't lead to real wholesale change.
Yeah, Kevin, Royce just touched on something really important, and that is, and it's for a much, much longer conversation, government mission creep. And I know it's something that you're aware of, having been in government, that governments get away from their core responsibilities because there are all kinds of other worthy things to be spending money on. And you saw this at City Hall, and you saw it at the provincial level, and of course it happens at the federal level as well. But we have to get down again, and maybe we can do a whole other podcast on this one. What are the core responsibilities of our government? And beyond that, when they're doing those things really well, then maybe we can think about branching out. But the government mission creep at every single level has gotten so far out of hand that we no longer perform the core responsibilities effectively, and healthcare is one of them.
We need to do a
Yeah.
show on that, and we will do a show on that because I can tell you that if you asked a politician what the core responsibilities are, they can't answer you, or they will each have a different answer based on what they believe or what the groups that they belong to believe or whatever. And you're absolutely right. We have to get back to our core responsibilities of the government at every level. That's what's wrong with this country. That's why spending's out of control. And I would love, let's do a show on that.